All right. So today's question is, does insurance cover TMS for depression if the patient has other mood-related comorbidities like anxiety, OCD, PTSD, etc.? This is a summary of the question. You can read the details. It says, how does insurance decide whether your TMS for an appropriate condition if, say, you have several comorbidities being treated in addition to depression, but depression isn't the primary issue? Do they judge this based on the part of the brain that the doctor is stimulating? Okay, so it's common to have comorbidities in psychiatry, but particularly for depression, if some patients had, say for example, anxiety and depression are common to be comorbid, PTSD and depression are common to be comorbid, OCD and depression are common to be comorbid. Comorbid means two morbidities, two illnesses happening at the same time, okay? So in this situation, if somebody is treatment-resistant depression for their depression, meaning that we tried SSRIs, we tried psychotherapy, it's not working for them, we're looking at TMS. But the patient also say, let's just take an example outside of this, just patient has comorbid PTSD, okay? Then would the insurance pay for TMS for the reason of depression, or would they say no because patient also has PTSD? So the answer to this question is dependent on what is currently the number one diagnosis. So when we're listing diagnoses in psychiatry, we have to list them according to how disabling they are to the patient. So if depression is the most disabling thing for the patient today, but they also have PTSD symptoms, so depression becomes number one, okay? And in this situation, yes, insurance will pay for TMS for the reason of treatment-resistant depression. But if somebody has PTSD and PTSD is the primary symptomatic diagnosis at this point, and they do have comorbid depression, but it's kind of like lower on the list of how morbid that is, like how severely that is affecting their life, then insurance might say no. So we have to be, your doctor has to evaluate you, for what is the number one, and also document that, and making sure that what we're trying to achieve now is, improvement with depression. Now, that being said, there are other mood disorders that could actually block your approval for TMS from your insurance. For example, bipolar disorder, okay? So the jury is still out about TMS for bipolar disorder, particularly bipolar depression, meaning that you have bipolar, you're in a depressive episode. Can we stimulate that patient or not? Obviously, we're not going to stimulate somebody who's in manic or hypomanic episode because this could make it worse. But if somebody has bipolar depression and they're currently in a severe depressive episode, and that severe depressive episode did not respond to medication, therapy, and what have you, and we need to lift the patient up some, could we use TMS? The science answer is yes, most likely, though we did not have a well-designed randomized controlled trial to obtain an FDA clearance. And I think there was one that did not mature. There was one from Neuronetics that was supposed to evaluate TMS for bipolar that did not mature. But the idea here is that particular diagnosis could actually get your insurance to say no, do not do TMS, because MDD is baked into bipolar. So you cannot have like, oh, I have MDD and I have bipolar, and MDD is more important. MDD meaning major depressive disorder, and major depressive disorder is higher on my list now, than bipolar. That's not how it works. The word bipolar means that you have MDD, okay? So you have that included in your bipolar. You switch in your mood from manic symptoms for a week, couple of weeks, what have you, to a depressive episode that's usually longer, weeks to months, okay? So that is the one diagnosis that will not be okay to do TMS then. Also, everything we talked about is comorbidities from the mood disorders class. If you have psychotic disorders, then that does everything I said does not apply. If somebody has schizoaffective disorder or schizophrenia with negative symptoms, and they have comorbid depression, and we want to treat the depressive episode in there, we cannot at this time, because we don't have like enough evidence that it's effective. That being said, there had been publications showing positive results for a patient with schizophrenia and negative symptoms, and it seems like negative symptoms improve with TMS. Again, that's science usually ahead of regulation, okay? So insurances are going to take their sweet time, 5 to 10 years, before they would admit that, if somebody has schizophrenia and they have negative symptoms and nothing is working for that, let's go ahead and proceed with TMS for that reason. Okay, so the answer to this question is yes, it's okay to treat MDD if it's the primary diagnosis and all the other comorbidities are less urgent of a matter, so they're number two, and beyond. We cannot do that. Doesn't apply to bipolar disorder because bipolar means somebody has MDD, and other comorbidities that are in this psychotic class of illnesses. At this time, it probably is not okay to do TMS. All right, thank you for the question. Disclaimer: although I am a psychiatrist, this is not a professional advice as I am not familiar with the specifics of your unique situation. Please contact a psychiatrist in your area with more questions. This disclaimer is added to my answers on social media after consulting with the American Psychiatric Association. Thank you.